how you can explain the phenomena, how women, when they're like, say, more
pheromones.
Two, when they're in the same living quarters, they're, you know,
Yeah. It's a
here's
scent.
the line.
It's a scent that women produce. It's pheromones. And what he's asking is, and I'm sorry I cut you off, because I knew what you're going to ask, and I'm sorry. Oh, you couldn't ask it anyway? He was asking, how is it that women who live together will start cycling together? Their periods will start coming around the same time. And that does happen. And that's because of scents that a woman produces when under the influence of these different hormones. Oh, the other thing that progesterone does is it makes the skin and the hair greasy and gives a woman zits. Okay? Because the body doesn't care anymore. It's, oh, he's got that guy. She's probably pregnant already. So if you get a pimple, women in here, don't despair. Just use it as a fertility indicator and just say, oh, got a pimple. That's progesterone. Ovulation must have occurred. Okay? All right. So you know how an egg gets fertilized. And if you don't want that egg to get fertilized, there are some things that you can do. Okay? Now, let's talk about the hormonal methods. Now, the hormonal methods are Norplant, Depo, and the pill. Do you want me to just lecture to you? Or would you ask me a question about Norplant, Depo, or the pill? Anybody have a question? Yes?
If women, like he was saying, like roommates, if they're on this hormone type of 3, they don't produce that scent, right?
Right. So if you're in a sorority with women who are all on the pill, they're all going to be on remote control.
Yeah.
Wherever they are in their pill packet, that's where they're going to be. Good question. Any other questions? You know everything about Depo? And
No.
Yes?
How serious is it if a woman misses like a couple of days when she's on the pill?
Okay, it's serious. The question was, how serious is it if a woman misses a couple of days on the pill? Okay, the pill has estrogen and progesterone in it, just like this was. Okay? And it puts estrogen and progesterone in the body the same as if the woman were pregnant. So the body says, oh, she's pregnant already. I don't have to release an egg. Okay? You've got progesterone there and estrogen that's stopping the egg. The other way these hormonal methods work is the lining of the uterus doesn't build up very much. Okay? Oh, I know what I forgot. So if the lining doesn't build up very much, then a fertilized egg, if there is one, can't attach. So if she does not put these hormones in her body for 2 days, the body says, oh, okay, she wants to get pregnant. Okay, we can do that. So she can release an egg. The lining will start building up. Even missing a pill by 1 day may not be safe. Okay, 2 days is definitely not safe. Yes?
What is Depo? Is that the positories?
Thank you. Is it what?
Positories? Is that
No, but Depo Provera is the real word, and it's the shot.
No.
And only in Santa Barbara, okay? We had some woman call in and say she wants the Depo Primavera. Like she had a little too much Italian food. Okay, let's talk a little bit about mucus and how these hormonal methods change it. Now, most of the time, there's a big plug of mucus, right, around the cervix, protecting the uterus and tubes. Now, that mucus is thick and sticky and tacky, like the paste that you use in 3rd grade, and some kids ate it. Did you eat it?
Yeah.
Anybody in here eat it? Did you smell it? Yeah. Okay. So most of the time, the mucus that a woman is producing is like that. It's thick, it's sticky, it's tacky, it's pasty, and sperm cannot get through it at all. Bacteria can't get through it, and sperm can't get through it. And if you look at it under the microscope, the molecules are all in a little mesh. They're all over each other, just sticking to each other. And the sperm comes up, bangs his head, and gone. So this is infertile mucus. and it's pasty. Okay. This mucus is acid. Can sperm live in acid? Do you remember like 5 hours ago when we were talking about the vagina? Can sperm live in acid? No. No. So this is not good for sperm. This has something called leukocytes. Anybody know what leukocytes are? Okay, they're white blood cells. Anybody know what white blood cells do? Yes, what it is the army of the body. If there's any foreign invader, anything that it's not supposed to be in the body produces these white blood cells, and it's the army, and it goes out and attacks the invader, the bacteria. But for women, sperm are invaders, and the body sees it as that. So it produces this sticky, tacky mucus that has the white blood cells that kill sperm. It also has an antibody to sperm. So that kills the sperm. And it has an anti-enzyme. Any clues as to what that anti-enzyme is? Wild guess.
Anti-sperm.
What?
It's anti-sperm.
Yes, good. Remember the enzyme on the head of the sperm? Well, this infertile mucus knocks out that enzyme. So even if the sperm can get through this, it doesn't have enough enzyme or any enzyme on it to soften the shell of the egg and slip in. So while a woman is producing this infertile pasty mucus, there's no way that she can get pregnant. And that's most of the time. Okay? As the woman gets more estrogen, as she gets closer and closer to ovulation, the mucus is going to change, it's going to thin out, it's going to get more watery, it's going to get more copious, she's going to feel wet. There'll be a wet sensation on her vulva, that's the opening to her vagina. And this fertile mucus, instead of being in a mesh, is in a column. Okay, so this is fertile mucus that's coming out of the cervix. It's produced in the crypts, right? So this column of mucus makes the mucus stringy and stretchy, like clear egg white. And sometimes a woman will find that when she's wiping herself after she uses the toilet. She says, oh my God, what's that? And she thinks it's something really bad, but that's something really good. This is fertile mucus, and fertile mucus is good. All mucus is good. Can you say that? Mucus is good? Mucus is good. Right, mucus is good. All right. And wait till you hear about this. See this column of mucus? This column vibrates. And it vibrates at exactly the same frequency as the tail of the sperm vibrates. So the man ejaculates, sperm gets right in here. The distance between one molecule and another is the same size as a normal sperm head. Man ejaculates, sperm gets locked in here and gets jiggled up to the safety of the crypts. Okay? It also means that any sperm that are not vibrating in sync with this don't get on, and any sperm that have a weird head don't get on. So you have this genetic screening process. They're stuck in the vagina, dying. Okay? Did you know that? Isn't that incredible about mucus? Here's some other stuff. Instead of having acid, it has alkaline. It's alkaline. You think sperm like that? They love it. They love it. All around here is that acid vagina, and here is this wonderful alkaline mucus, and sperm just love it. It doesn't have the white blood cells, it doesn't have the antibodies, it doesn't have the anti-enzyme, but what it does have is glucose. Now I know you know what glucose is. What's glucose? Sugar. And it's the sugar in this fertile mucus that lets the sperm live in the crypts for 5 days. It's the food for the sperm. See, I told you mucus was good. It's incredible stuff. Okay, so for your hormonal methods, that's the pill, Depo, and Norplant. They give you hormones that suppress ovulation. The lining of the uterus doesn't build up very much, so an egg cannot attach to it, and it keeps the mucus thick. The mucus is always this killer mucus. It never gets thinned out. Okay, so those are the 3 ways that the hormonal methods work. Now, ask me a question about the shot. Yes?
Can you tell me a little bit more about the Norplant?
Sure.
Like the incision?
Do you want to know about Norplant and the incision? I'm going to pass some Norplants around. This is some in the arm. Just feel it. Don't try to take it out. Here's some Norplant rods. Now, the incision, she asked, is about like a paper cut, like a 1/4 inch cut. And they put a little template on the arm, and they draw lines. And then they make that little cut. And they have something called a trocar. It's just little metal, like a tampon tube. And they stick the little tube of the Norplant inside it. You can see she doesn't like that.
Oh, no.
Oh, it looks like a, not me, not me.
No,
Oh. And then they just place it in that little hole and push the plunger, and one comes out. Then they move that little trocar, load it up, push the plunger, another one comes out. And they do that 6 times. There's 6.
Do they use a local or anything?
Yeah, give you a local anesthetic. You don't feel it.
What about the side effects?
Okay, side effects of Norplant. With Norplant and the shot, the depot, they only have progesterone in them. Okay? So progesterone, do you remember? Don't have it up here. Progesterone does what to skin? Oily. Breakouts. Okay. So people who are on Norplant or depot may have more acne. That may happen. Now, do you remember what it does to the mood, what progesterone does to a woman's mood? Mellow, but if you get too much of it, what's that mellow does?
Tired.
And depressed. So some women can get depressed. It will also change their bleeding pattern. Now, especially with the shot, women will not have their normal periods on the shot. We can guarantee that. For most women, they won't have any periods while they're on the shot. Some people like that, some people don't like that. How many of you would like that?
What about weight gain with this shot?
With the shot, probably will be a 5-pound average, a 5-pound weight gain. The women can get the munchies, so they have to be careful about that. There are 3 things that we know almost certainly will happen to anybody on the shot. They won't have their bleeding pattern, their regular one. Probably will not have any periods at all, especially the more shots they have. If the lining of the uterus manages to build up a little bit, it's so thin that it cannot stick to the uterus and it keeps dropping out. And that would be spotting or irregular bleeding. So that's probably will happen, either no periods or spotting and irregular bleeding for a while. We know that it may take up to 1.5 years to get pregnant after the last shot. So if someone wants to get pregnant in the near future, that's not a good idea. And we know you're going to get the munchies. Almost everybody will do that with the resultant 5-pound weight gain. Some people gain a lot of weight, and that seems to be the women who already have problems with weight. Those things are probably going to happen. Some things that may happen but probably won't will be acne, depression, headaches maybe. Okay, he had a question.
Is the reason that they don't have a period is because those eggs are not produced, or?
No, there's another reason why they don't have a period. What's the period? Where does it come from?
The
Uterus.
uterus and the eggs like dying and they push them on.
Okay, well, yes. Okay, the dying eggs, good. Okay, so if you have a lot of progesterone and the lining isn't building up, what's going to happen? If it's not building up at all,
It's not strong enough to stay so.
if it doesn't build up at all, nothing's being built up, will she have a period?
No, because nothing there to come out.
Right. Okay, so is it harmful then to do that? A lot of people think they just, you know, it's building up and building up, they're going to explode someday in their math class. But it's just not, that's not going to happen. Yes?
I was just curious as to if modern technology is coming up with like a new way so that women don't get depressed on these and get, you know, spotting and mood swings and
There's nothing really wonderful on the horizon.
Yeah.
There's no free lunch with this. You have to just get one that you can be pretty happy with. But I tell you, most people are really happy for the most part. With Depo, we cannot keep it on the shelves. Why do you think that is? Why do you think? What?
I think people just want to get a shot to have sex.
It's easy, right?
And then you
It's
don't have to
easy.
worry about it for like 3 or 4 months.
12 weeks. You don't have to worry about anything for 12 weeks. Why else do so many people like it? No period. No PMS, no cramps for most people. Why else would someone choose it? Any other reason? Is it private? Is having a shot private? Yeah. Is mom going to see any condoms or pills or something around? No. We encourage our patients to talk to their parents, but as you know, probably maybe for yourself, that's not always possible, or it's something that you want to keep private. So it's very private. Do you have to do anything around your sexuality? Do you have to stop and say, oh, wait a minute, we have to do this? No. Do you have to ask a man to do something? God forbid? No. Do you have to touch your body? No. Yes?
Well, somebody already asked the question, how often do you have to get the shot? But this is sort of related.
Good.
If you were how old do you have to be to get the shot? Any age. You don't have to have parental consent?
No. No, any age. And we have people coming in with stuffed animals, stuffed toys. We want them, but that's a whole other thing. You don't know what's happening. They may be being abused, and then they don't have a say in what's going on. Yes?
With the Depo and the Norplant, is it immediate?
Oh, good question. Good question. She asked, with the Depo and Norplant, is it immediately effective? Now, with the Depo and Norplant, you can get your first shot of the Depo or the Norplant either during a woman's period. If she has it during her period, then it's effective in 24 hours. We would like you to wait till you leave the clinic, okay, to use it. Thank you. And then if she can get it if she hasn't had intercourse for 2 weeks. So if you get it after 2 weeks of no intercourse, then it's effective in 2 more weeks. So what do you think most people choose? Come when they're having their period. Yeah. Okay. What other kinds of questions? Does anybody else have one? Yes?
I've heard of people, like women growing mustaches and whatnot.
Yes. That's the other, not a whatnot, but maybe a mustache.
Body hair.
Yes. That can happen. You can have less head hair, more body hair. If we could just turn that around, we'd have a great method of birth control, right? You have this nice hair and no waxing. Okay. So what's the effectiveness of Depo? Let's talk about it. This is the effectiveness rate. This means out of 100 women using this method for a year, this many will not get pregnant. Okay? So we have a typical use and a perfect use. Did I do that right? Yeah. Typical use and perfect use. Perfect means if you did it exactly the way you were supposed to every time. In theory, this is the way it should work. Typical use is what happens when most people use the method. Imperfect use. Now, some people can get perfect use. Some people cannot. You have to decide where you are on this. Okay, so Depo. What about Depo? What do you think?
It's nothing you can... Well,
Is it very effective?
yeah.
Extremely effective, hassle-free, private. You don't have to do anything around sexuality. That's why a lot of people like it. Very effective, and it's foolproof. It's a no-brainer. Okay, what about Norplant? Same thing. Norplant is good for 5 years. Now, we would like you to try Depo first before you get Norplant. Okay, the pill, 97, 99.9. It's a lot easier to screw up on the pill. Okay, ask me some questions about the pill. What's the worst thing you've heard about the pill?
You're not supposed to take the pill if you're 35 and stuff.
Oh, good. I'm glad you asked that, because they changed that rule. Women can take her, she asked if you're 35, you're supposed to stop taking the pill. You can take the pill, you can go through menopause, and you can segue right into hormone replacement therapy if you want.
Even if you smoke?
No. If you smoke, then you cannot. Over 40. Over 35, you can. Yes?
That's what I was gonna say.
Now, if you smoke, no. What else about the pill? Works the same way. So what's a woman's period's going to be like? It works by not letting the lining build up very much. No egg, thick mucus. So what's a period going to be like, women using the pill?
1 to 2 days.
1 or 2 days, maybe 1 or 2 spots.
Yeah.
It could be. Yeah. So that's another reason why women like to use the pill, too. Okay.